Hello, I'm Laurence Fishburne. The field of healthcare is constantly changing and improving. Every day, modern medicine holds the promise of a new treatment or healthcare technology. It takes the vision of determined thought leaders to unlock the next big breakthrough, as we're about to see.
It's a troubling reality. Over 40 million Americans are living without health insurance. The overcrowded and costly hospital emergency rooms have many patients feeling that America's healthcare system is broken. In an ER, patients receive life-saving treatment, but are often subjected to unpredictable waits and impersonal care. There is a profound need for a fundamental shift, one that focuses on access to affordable healthcare and a new paradigm that focuses on the patient experience.
I'm a board-certified emergency medicine physician, and I've worked in the ER for a long time. And I've recognized 4 problems that patients understand as well. It costs too much, it takes too long, it's too complicated, and then at the end of the day, the staff in the emergency department is really not that nice to patients. So patients want a place that they can go to where they can get treated and cured and their life saved from their medical illness, but they also want a place that they can go to that they have a great experience and that all of these frustrations are solved and handled in a way that the hotels and the restaurants do for their customers.
So it's very difficult for the emergency department to be fast, friendly, and affordable when they are the answer to so many of the other components of our society that are broken. When people are desperate, when people are in pain, when people have a flare of any illness and their doctor's office isn't open, they come to the emergency department. So it's just the sheer numbers of people that are there and the general expectations that the ER is going to solve many problems that are much greater than just handling the emergencies that are happening in a given community.
Across this chain of urgent cares throughout the St. Louis area, the doctors and support staff are striving to show the world how healthcare can be delivered 365 days a year.
So I took all of the great features of the emergency department and then I matched them and melded them with all of the customer service features from the great hotels and restaurants in our communities. And I tried to create a hybrid approach that values both the medical experience of the patient and the customer service.
Staffed with board-certified doctors ready to treat any number of injuries and illnesses, the goal is to offer a unique patient experience that is fast, friendly, and affordable. In less than 1 hour, 85% of walk-in patients are registered, evaluated, tested, treated, and discharged with medications in hand.
Our whole goal is to provide the services that are complete. We want one-stop shopping, and we want patients to not have to go to additional locations or additional facilities in order to solve their problems.
For those seeking immediate medical treatment for injuries and illnesses, talk is the solution to overcrowded ERs and the rising cost of healthcare.
Unfortunately, today's ERs are not very efficient places. They need to triage their care in such a way where some of the issues I've been having, constant UTIs, which are serious for me and can end up septic, will put me on the back burner. When you walk into a total access urgent care, you are met with both the best of the art and the science of healthcare. The science, of course, is important, that's why you're there, but you are greeted warmly, you're greeted with compassion.
We have shown that it doesn't have to be unfriendly, you don't have to wait, it doesn't have to be a scenario that is inherently often frustrating or disrespectful.
Inventive and enterprising ideas like these may provide an alternative to overcrowded ERs and the rising cost of healthcare.
Today's advances give us hope for a healthier tomorrow. Thank you for joining us. I'm Laurence Fishburne.